Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
Hey, Nita, how are you today?
I'm great. How are you?
I'm living it up. And you know what's so funny?
What?
When patients walk in the door who have heard us on the radio, the first thing they say is, living it up.
That's pretty cool. We're training the world to live it up. That's a good thing, right?
Why not?
Yeah.
If you have a choice, you may as well decide to be happy.
Well, here's the thing. We want everybody listening to be happy, and if you're suffering from chronic musculoskeletal pain or orthopedic pain, basically, you want to give us a call during this hour so you can speak to Dr. Darrow. That number is 866-870-5752. And what we're talking about is muscle pain, joint pain, ligament pain, tendon pain, disc pain, back pain, neck pain, knee or hip pain, arthritis pain, and maybe you have stiff joints or dull aches and you don't even know what kind of pain it is. So if you think it's orthopedic pain, give us a call. That number again is 866-870-5752 right here in the studio. And also check Dr. Darrow's website at www.lastemcells.com. That's lastemcells.com. And you can email Dr. Darrow off of every page on the site and watch him performing the treatments on videos. And a reminder that we are here Saturdays at 10 a.m., again at 1 p.m. And when you phone the program today, very important, you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has 264 studies, and the foreword was written by Suzanne Summers. And there is something on hair growth in that book also. So a lot of stuff, a lot of studies, a lot of science. You don't want to miss out on that. And our number again is 866-870-5752. So what do you think?
Well, I think life is amazing, and it's great to feel healthy and to have our orthopedic pain healed. There's so many people who... we have Dr. Weinzoff. I see him on the screen. Just take him right now. We don't have to screen him.
Okay.
I know who he is.
Okay.
Can we hear you, Dr. Weinzoff?
I can hear you loud and clear.
All right. I've been waiting for you. Thank you so much for your treatment yesterday, and I'm feeling so much better. And
my pleasure.
Dr. Randy Weinzoff is in Santa Monica on Broadway. And why don't you give out your phone number, Randy? Randy is a chiropractor. He's my chiropractor.
Oh.
Okay.
And,
its telephone number is 310-395-0260.
Great. Everybody write that down. Give it out again, Randy.
It's 310-395-0260.
So I've been sending patients to Randy for years, and he's amazing. I send my family to him. I send my friends to him. And he's one of the greatest chiropractors, probably is the greatest that I've ever been to. I would have to say you are probably the best that I've been to, and I've been going to chiropractors most of my life. I discovered chiropractic when I was in Berkeley many, many years ago, 50 years ago. And you would definitely have the touch. They say you have the hands of God.
Well, I got to say,
wow.
right back at you. You are by far the best mechanic with a needle of anybody I've ever sent anybody to.
Well, it's pretty true. Mechanic with a needle is pretty accurate as to what I do.
Exactly.
So, what's interesting is I have some dead-end cases, meaning people that cannot be helped with regenerative medicine using platelets or stem cells, which is what I do, and they will end up going to Randy. And Randy has some dead-end patients that need the regenerative medicine that end up coming to me. So, Randy, I just wanted to thank you so much for your dedication to your patients and to me personally and to my family and friends. And
hey, it's the perfect synergy. Let's keep it going. We got to get everybody healthy.
Absolutely.
I love it.
Give out your phone number once more for people that just tuned in.
Sure. It's 310-395-0260, and we're right off the corner of 20th and Broadway in Santa Monica.
Cool. All right,
Great.
God bless you, man. You have a great day.
Thanks,
Randy. Appreciate it. Have a great day. Bye-bye.
Bye. Okay. Give us a call, 866-870-5752 here in the studio. And we're going to Arthur in Dana Point.
Arthur, I understand that you've got an SI joint that's bothering you. Which side, left or right?
Right side, and
Okay.
occasionally the left flares up. I've had a long history, 30-some epidural injections. I got
Oh, my God.
degenerative disease all the way up and down my spine,
Yeah.
from S1L5 to T1011.
Okay.
But recently, over the last few years, my SI joint has been acting up. It's like an open nerve. It's like a knife going through there. I recently had an epidural and an SI injection, and that seemed to calm it down for a few days. We'll see if it calms it down more permanently. Very scared, and it's just like it's an open nerve. It's like
hear
a
you.
knife going in there.
Yeah, the good
beg your
news
pardon?
is, I have some good news for you, okay?
Okay?
You want it? The good news is, generally, the work that I do using platelets from the blood, called PRP, platelet-rich plasma, or if I think it's severe enough, we'll consider using your stem cells for it also. These things can generally be healed up. And although you had epidurals for 30 years, they haven't helped. And you just had another one, and you're hopeful it's going to help. But what's Einstein's definite...
It's a steroid injection in the SI joint, not an
I hear you. Okay, I hear you. It's the same thing. It's the same idea. It's a big blast, a giant dose of steroids, meaning, like prednisone-type medicine of 60 to 80 milligrams. And I could put that, I'm being facetious right now when I say this, I can inject that into your eyeball and your back would feel better. Okay?
Okay.
Because it goes systemic. It's one of the worst things you can do. I'm not putting your doctor down because it is traditional medicine, and that's what they do. It's not a way to heal anything, and I would never do it. I would never give that to you. I'm not putting down your doctor because that is traditional medicine, and that's what they do. But I don't find when people get that it fixes anything, and I do find that what I do by injecting the general area, and I use my hands to find the problem. I use my fingers to scope out where the pain is being generated from. It's usually the ligaments around there, and typically people that have this syndrome have what we call, my favorite word, by the way, Nita, an enthesopathy.
Yay.
And it just means where the ligaments, tendons, muscles attach, or the fascia attaches to the bone, is where the pain is being generated from. And we can grow that tissue back and strengthen it and get rid of the pain. So, Arthur, just talking to you on the radio, I don't know for sure if what I'm telling you is true, okay, for you. I have to touch it. If you want to come into the office, I'm going to give you a phone number right now. It's 800-300-9300, and we have people by the phones, and you can ask more information about this. But most people that have what you have, the way you're describing it, get better using regenerative medicine of just platelets or platelets and stem cells. And when I say get better, that doesn't mean they get 30 years of epidurals or 30 years of my treatments. It usually takes, 1 to 3 treatments of what I do to fix that general area. I'm not promising you anything. I don't know you. I haven't touched your body. I haven't examined it. But generally, that's the case, okay? And for the rest,
pain was so bad that I was trying to avoid. I hate drugs, but it was beyond. You can't even see straight. There's so much pain.
Okay. Well, I'm going to tell you my story, Arthur. I had the same thing years ago. I had it so bad I could barely walk. And at the time I was a resident at UCLA doing my residency. And when I'd go to the hospital, I'd have to kind of hang on the wall and limp along to go see my patients who were actually healthier than I was, but I never complained. And that's gone. I haven't had that in years and years and years and years. Okay? So I'm not telling you you're in the same category I am. I have to touch the body to see if I'm correct.
Yeah.
But most people that describe what you describe, they get the epidural, they feel great for a while, then it comes back after a while, are in your category of being able to be healed by regenerative medicine. And it's easy. You walk into my office, we draw your blood, we spin it, and we inject the platelets, we throw away the red cells, or we could possibly use your own stem cells and do it that way if it was a bad enough case. And a lot of people come in with what you have, and they're ready to have surgery, or they've already had surgery that failed, and we can still fix them. So there's good hope just talking to you that we can help you. I can't promise you anything. Again, our phone number to the office is 800-300-9300. And if any of you folks listening want to talk to me right now with your questions or questions about your family or your friends, your workers at the office, the number right here to the studio is 866-870-5752. I'm going to repeat it while you get your pen.
Okay.
866-870-5752. I would love to talk to you and figure out what's going on with you.
Is any of this covered by insurance at all, or no?
That's a question you're going to have to call the office for, and I'll give you that number once more, 800-300-9300, okay?
Thank you, Arthur.
Okay.
Appreciate your call.
God bless you, Arthur. There's good hope ahead for you.
Our number again right here at the station, so you can talk to Dr. Darrow, is 866-870-5752. That's 866-870-5752. And check out that website, chock full of information, www.lastemcells.com. That's lastemcells.com. You can email Dr. Darrow off of every page on the site and see him performing the treatments on videos. And remember, when you call the program today, you get Dr. Darrow's latest book for free. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And if you want to know what that means, give us a call right here, right now at the station at 866-870-5752. Your turn.
So, yeah, my turn. Thank you. That's what I always say to you.
I know.
I'm going to take a question. I get questions all day and all night long from the Internet. And if you go to my website, you can email me from there. The website is www.lastemcells.com, www.lastemcells.com, and there's a spot on every page to email me. And I love your emails. I answer them first thing in the morning and last thing at night before I go to sleep and in between. So when I'm not with the patient, I'm running back to my office answering emails, which I really like to do. A lot of people don't like to be, quote, bothered, but I like to keep in touch with people. I'm a pretty gregarious kind of guy. And I love being in touch with my patients. That way I can help them the most. A lot of people, when they come back for a checkup, they go, I didn't want to bother you, I didn't call you. And I say, you hurt my feelings when you stay in your misery and don't get a hold of me. I want to know what's going on because I can often help you. So please get in touch with me when you need to. I give my phone number, my cell phone number, out to every patient who walks in the door. My card has my email address and my cell phone number. I like people to be taken very good care of. So I have a question that says, hip replacement. Let me see what the body of the email is. This person says, I am 64, and like many, I've been very active my entire life. I hiked the Appalachian Trail at age 41, and I don't know how long it takes, but that's like days and days of hiking. Still up until this year, I do a lot of hiking. About 3 months ago, my right hip all of a sudden started hurting. That's good news, by the way. It's hard to walk and very hard to go upstairs. Went to see an orthopedic surgeon, and after reviewing the x-rays, he immediately wanted to do hip replacement. He said there is no other option because I was bone on bone. How often do we hear that, Nita? He didn't even want to see an MRI. I live in Las Vegas, able to travel to see you if you feel like you may be able to help me. Yes, I would love to help you, and yes, I would like to see you, and yes, I do need to do an examination to find out what's going on. So I hear the same story all day long. Went to an orthopedic surgeon, and by the way, if you're listening and you're an orthopedic surgeon, I love you. You do very difficult work. The problem is all the surgeries that are being done that don't need to get done. We hear it all day long. I need surgery, I have bone on bone. We still get these people better. Not everybody, I can't heal everybody. But chosen appropriately, most of the people that we see can decrease their pain or eliminate it. So, number one clue, it happened all of a sudden. That's good. If it happened insidiously, meaning over a long period of time, that might just mean that there's arthritis that is continuing to deteriorate a joint. But if it happened all of a sudden, it may just be a sprain, just like a sprained ankle. And that's good, because those are easy to fix in most cases. In this case, it may not even be the hip joint that the problem is. It may be where the muscles attach to what it is called the greater trochanter. And you can Google that and hit images and see where that is. It's not even the hip joint. Way too many people get surgery for a greater trochanter. I sound like somebody else. A greater trochanteric bursitis or tendinitis. And, well, that's something we can heal very easily. Unfortunately, surgeons often will do a hip replacement when that is not the problem. Even if you have arthritis in a joint, it often can be healed. You don't jump to get a surgery to replace a joint that's not going to last, that you can get an infection from, that you can die from anesthesia. I mean, I see these things happen all the time. So be careful, be safe. Always do conservative medicine. What we do is just injections. It's simple. It's easy. Stay away from the knife. I always tell people, once the knife goes in, it can't come out. The results are done. Be safe. Injections are a lot easier. So everything this person is telling me about leads me to think that this is not a terrible case, okay, that it's something that we can help with. So I'd love to see you. Come on down from Las Vegas. We got a lot of people, a lot of patients that come from Las Vegas. It's a quick ride, especially with the roads being open right now. So I'd love to see you.
Sounds good. Give us a call right here in the studio at 866-870-5752. That's 866-870-5752. Right here, right now in the studio, you can speak with Dr. Darrow. And if you are just tuning in and you want to know what we're talking about, it's musculoskeletal pain or orthopedic pain. And you get Dr. Darrow's latest book for free, Stem Cell and Platelet Therapy, Regenerate, Don't Operate. It has actually 264 scientific studies, and the foreword is written by Suzanne Summers. You've worked with her for a long time.
I've been taking care of her family for mega years. She has a new book called A New Way to Age, and she did a chapter on me in that about regenerative medicine, which is amazing. Thank you, Suzanne Summers. And she did write forward to my book, Stem Cell and Platelet Therapy, which we're going to give out to you for free if you give us a call right now at 866-870-5752. You can catch me live right here and ask me any kind of question you want about orthopedic medicine. If you have questions about other types of medicine, I may know about it, but that is not my specialty. I specialize in orthopedics and using regenerative medicine, which is just injections of platelets and stem cells into your body to stimulate new tissue to grow, which is a great way, an easy way to heal. I've used it on my body ever since about 1998, so that's about 22 years now, and I've had amazing success every time I've used it. I am a crazy athlete. I hurt myself all the time, and even when I start to hurt, I keep doing my sport because I love sports. I love repetition. I love things like playing guitar and 5-string banjo because that's repetition. I don't know what it is about repetition that I love, but I love improving and I love perfection. And it's kind of funny. People ask me about why I love doing the work I do so much. And I say because it's a sport. You know, the more I do, the better I get. And I've been told I do the most of anybody on the planet. I don't know if that's true. I do it all day long. I rarely take a day off. I love being in the office and helping people. Hey, Robert, Dr. Marc Darrow, you want to talk about your knee?
Yeah, my question is what do you think about meniscus transplants? My left knee has been bone on bone for the last 2 years.
Okay.
I exercise. I lost, 30 pounds. I bicycle. I don't run anymore because there is a little bit of discomfort, but for the most part, it's not an issue. But long term, and I happen to do a lot in my business with organ donation, and there was a person I met who had and received a meniscus transplant. What is your thoughts on that?
Well, let me first, before I get into that, let me talk about you a little bit specifically. If you're riding a bike, you do not have bone-on-bone arthritis in your knee, okay? Period.
Okay. Well, someone took
bone-on-bone. Oh, I know. I hear it all day long. I see the x-rays. I see the MRIs. And I tell the person they don't have bone-on-bone. If you're riding a bike, that joint is moving. If you're walking around, that joint is moving. Bone-on-bone means you can't move. It's like two bricks trying to rub at the end of the bones and the joints. Now, I know it's used by surgeons all day long to, I'm going to use the word seduce, a patient into getting a surgery. It shouldn't be used. It's a term that should be thrown out. And, there are cases when it is real. I've seen it, but it's so rare. There are cases where someone comes in and they can't move their knee or their hip or their shoulder at all. The shoulder is a little more complex because a lot of times people have a frozen shoulder, which has nothing to do with arthritis or bone-on-bone. But my point is this. You don't have bone-on-bone. So don't get spooked and think you need to get a meniscal implant or transplant. And my experience personally with it, because I've had a lot of patients who have had these, is total failure. That doesn't mean they all fail. Obviously, if they're still doing them, there must be some success rate to it. I've just never seen one that's been successful.
Mm-hmm. Well, I know that what I've been doing mostly works is keeping the weight off and exercising.
Well, you're doing the right thing. Stick with us till the break is over. It'll just be a minute.
Hold on, Robert.
I want to finish up with you, Robert. Yeah, you have some good information.
You're listening to Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil. Write down this information coming your way. I'm your host, Nita Valens, and we'll be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.